Been at AVIC in Iowa for about 16 years. Grew up on a farm in northern Iowa. I was interested in large animal practice and mixed animal practice. Went to veterinary school at Iowa State. Got an interest in public health and epidemiology. And then when I graduated from there, I went into a small animal practice for a few months. Then I went into the Air Force as an environmental health officer. I was located just west of London, England, and stayed there for about 4 years. Well, I saw a flyer that came to the base where I was located in England. It was advertising the PVPC, or Public Veterinary Practice Career Program. It looked interesting. It looked like it was going to involve population medicine and some involvement in international exports. I liked international travel, liked international export work, so I jumped at the opportunity. I interviewed for the job and ended up in Virginia. I was a field VMO, veterinary medical officer. I had responsibility for the eastern half of Virginia for the programs that we worked on, like TB in cattle, brucellosis in cattle, pseudorabies in pigs. And then I also had responsibility for exporting dairy heifers out of the port of Richmond, Virginia. I was there 2 years, and then I had an interest in getting into management, so I applied for the assistant AVIC position in Illinois. Got that job, stayed there 4 years. Have responsibility for personnel management, responsibility for budgets. I'm also the person that endorses the health certificates for international export. I work cooperatively with the state veterinarian on programs like TB, brucellosis, pseudorabies. So we both have field staff that we supervise, and essentially they're doing the same sort of program activities in the field. We also provide funding to the state through cooperative agreements to work on some of our programs. And then we each have our own programs that are unique. For example, the export work that I do is just my responsibility. The state veterinarian does not work on international exports. We would be co-incident commanders of our team. Basically, we try to follow what's called the incident command system. So we would be the incident commanders, and then our personnel would fill lower level positions within incident command. So we would jointly make decisions on how to handle the outbreak, and as long as we could handle it with our own resources, we would deal with it ourselves. If it got to be too large to handle with our own resources, we'd go up and ask for more help from the national level. Well, we really encourage the veterinarians to call us whenever they have a question or a concern. We're in charge of accreditation, and so that means that the private practitioners get accredited to work on our programs, and we really want them to call us if there's an issue. Say they are not sure whether something is quite appropriate or ethical, then we want them to call us, talk it over, and we can work through those issues with them. So we hopefully are seen as a resource for the veterinarians in the field. I like the variety. There's always something new. Every day we have a little bit of export work, and we're working with both producers and veterinarians, trying to resolve issues that come up. There's always some sort of issue with either testing or trying to meet the certification standards of a foreign country. So I like that work. One of the favorite things is solving problems related to animal agriculture. It's very rewarding to be able to help producers and practitioners with animal health problems, and international exports.